Good afternoon. Good afternoon. Happy Wednesday. Do me a favor, y'all come on in and do me a favor and let me know. Y'all know the routine. Let me know where you are watching from. Let me go over here and go live on Instagram too, because y'all know it's extra steps when you got to go live on Instagram. One day they're going to make it so I can go live on all three without all of these extra steps. But anyway, good afternoon, everybody. Come on in. I know I have not been live in a while. Come on in. Let me know where you're watching from. Okay, Boss is watching from San Antonio. Good afternoon. Oh, Princess in San Antonio as well. Oh, wow. Okay, Texas in the building. Hey, Percy, I miss you too. Thank you. Thank you. Thank you. Listen, I didn't realize I didn't post not one video in the month of March, guys. I know I haven't been on here in a while. But I have had a lot going on, y'all. I am back though. I'm back. I got a couple of updates I'm going to share with you guys, but I wanted to get on here, see if you guys had any questions. I actually just recorded a couple of videos that I'm going to be posting. I think I'm going to start posting my videos on Mondays. I don't know yet, but I just recorded a couple of videos. I said, let me go live. I have not talked to my people in a while. Hey, is that Joanna? Khalees, I think I just got a package out front. Hold on one second, guys. I'm sorry. I had a feeling this was going to happen as soon as I went live. Let me look at my camera. Hold on, guys. I'm sorry. Just keep letting me know where you're watching from, but I think I just got my package. Oh, I guess not. I thought I just heard somebody throw something. That's how they do it these days. All right. But anyway, let me get back to this. Kate, what's that? Khalees? Tell you I passed. Congratulations, Khalees. Hey, Tamara. Is it Tamara or Tamara? I'm guessing it's Tamara. Hey, Jennifer from New Hampshire. Hey, Bree. Elsa from Maryland. What part of Maryland you from, Elsa? Let me know, because you know I'm right across the street from Maryland, but it depends on what part of Maryland. Hey, Yanira on Facebook. Ball says I'm taking the NHA in July. Indianapolis, Chelsea. Hey, Chelsea. I recognize your name. Chelsea, were you just on the study session with me last weekend? Let me know. Your name looks familiar. Let me know if that's you. Hey, Dolores. It's funny. So listen, y'all, when y'all put Miss K, this is so funny. Y'all know my name is Kendra. So it's K, it's not K-A-Y. A lot of you guys do this. I'm not mad at it. I get it. But I just want you guys to know that it is K, not K, because it's K short for Kendra. So this is hilarious when I see that. Hey, Matu, checking in from Elkton. Hey, Quizm, I haven't seen you in a while. Okay, Tamara says I'm about to do my NHA exam on April 30th. Listen, everybody that's about to take your test, make sure you stay tuned in. I'm going to give you guys some tips. Let me know if you guys have any questions. You got me for a little bit this afternoon. So just let me know. Any questions you have, put it in the chat box now. Let me remove this banner here too, because I want to show you guys my new little intro. Let me know what y'all think about my new little intro. Hold on. Where is it? Let me go to it, because I want to show you guys. Look at my intro, guys. Hold on. Look at this. How y'all like that? Let me know what y'all think about my intro. So that's going to be at the intro of my videos going forward. Let me know what y'all think about that. Okay, let me get back to this. Hey, is that Parrot? Ross from Pennsylvania, but I'm from Peru. Oh, wow. Okay, Ross. Watching from Arkansas. Y'all are all over. Cassini. Hey, Cassini. Michelle. I've been out of school for a year and still haven't taken my state exam for MA. Do you have any suggestions to help me get ready? Yes, I'm going to give you guys some study tips in a few minutes. And listen, I'll say the same thing over and over. So if you watch my study tip videos, it's literally going to be the same thing. New Jersey, Texas, scared for the NHA. Anyone have any tips? Yep, I'm about to give you guys some tips. Oh, water. Oh, yeah. Okay, you close. Shonda on Facebook. Hey, Shonda. Taking my exam in 3 weeks. I'm so nervous, but I've been an MA for 4 years. I just never took it. And my job. Oh, that's awesome. Your job is paying for it. What are you using to study, Chelsea? Let me know. Let me put my you guys know I have my MA refresher course too. For those of you that's getting ready to take your test, let me put the link in the chat for anybody that's preparing for certification, especially if you've been out of school for a while. Let me see, where is that link? Let me put it here. I'm going to put it right in the chat so you guys can have that. So if anybody is studying for their test, I just put it there. Let me go over to Instagram. I always forget about Instagram. Hey, Instagram. Trejo, helpful advice. Congratulations. Somebody said I'm currently on my second time. I'm sorry, Instagram. Simply R, congratulations. All right, let me see. Oh, she said period. Chelsea said period. Oh, y'all like it. Okay, listen, I'm loving. Okay, thank y'all. Jayla. Hey, Jayla, Bree. Oh, no, Chelsea, that wasn't you. Okay. No, it's okay, Cousin. I haven't been on here. It's perfectly fine. It's perfectly fine. Waco, Texas. Y'all are from all over. Okay, guys. So somebody says, what advice would you give to a student who learns slower and needs some tips to retain the material? Okay, so listen, I have had students like that. One of the most helpful things for you is going to be flashcards. You're going to have to flashcards, and then also periodically get somebody to test you from those flashcards. So just randomly give them to a friend or family member, and have them, just quiz you on what you have on your flashcards. That's going to be the biggest way. And of course, repetition, keeping it in front of you, watching videos. Of course, studying can look so many different ways. Studying your flashcards, watching videos, having somebody to test you. Those are ways to study, but it's going to be really repetition and keeping it in front of you, because you guys want this information to be so familiar to you that it's literally like, how 2 + 2 = 4. You'll never forget that. This is how you want this material to be to you. You want it to be to where you can just speak it, right? Without having to see the options. You need to be able to ask open-ended questions. So try to get to that point of being able to answer open-ended questions. Study time for you. For those of you that, especially that learns a little slower, you're going to have to set a time, some study time. So if you say like today is Wednesday, right? I'm switching over to full time as of Monday. And that's one of the announcements I was going to give you guys. I'm going back into the field, back into the office, outside, taking a break from the classroom, going back to the field for a little while. And one of the things that I just had to do was create a schedule, right? So I said Wednesdays are going to be my days where I record YouTube videos, right? So I have to have a schedule to keep me on track. So when it comes to studying, you have to have a schedule, and you almost got to kind of look at it as clocking yourself in and out. You guys know when you go to work, you have a certain amount of time that you have to be there, right? Look at studying like that too. Okay, from, you might say Wednesday evenings or whatever, from 6 to 7, or 6 to 8, that's my study time. I'm going to turn my phone off. Nobody can get to me. My kids are going to bed. 8 o'clock, that's going to be my study time. 9 o'clock or whatever. You got to put that study time to the side and utilize Kahoot. Y'all make sure y'all take advantage of Kahoot. There is games on there. I play those games with my students. It's fun, and it's a good way to retain the information. Job search with no experience. This is a big one. So listen, guys. So for those of you that are trying to find a job, I probably sound like a broken record to some of you guys, but y'all always know I say, first thing you want to do is find a medical assistant recruiter, a medical assistant recruiting agency in your area. Why? Because they get paid to help you find a job, right? That's their job. They're going to be on it. So look up medical assistant recruiting agencies or medical assistant staffing agencies in your area, right? Also, you want to go around to some private offices. Of course, you got Indeed and other job sites and stuff like that, but the recruiter is going to be your number one way. And then also going around to some private offices with copies of your resume and dress professionally when you go. So you guys have options, right? You got hospital sites in your area. But that most effective way is going to be a recruiter, because they're going to ask you what you're looking for, and they'll be able to match you to somebody that's okay with you being brand new with no experience. Okay. Hey, Bradley family. I'm finishing up externship. I'll be able to schedule my tests anytime after May 12th. What can I do to be sure I pass the first time? Also, it will be through the AMA. Okay. I just put my MA refresher course link in the chat. Guys, I have had a successful, I have to do a account so I can know my passing rate from the course, but pretty much everybody that has my course has been passing. My students, my actual students at my school, 100% passing rate. But I recommend my MA refresher course because it helps you to prepare, especially if you don't have the study material already. The study plan, for those of you that have not downloaded the study plan, why is my thing freezing up? Can you guys hear me? Why am I freezing up? Why is my video freezing? Let me know if you guys can hear me. It looks like my video was frozen. Oh, goodness. Let me get on there from my phone. This is ridiculous. This is so ridiculous. I should have made sure I was logged in on my phone. Let me know if you guys can hear me. Let me scroll down. I can't even scroll down. This is just ridiculous. It's always something with technology. Let me know if you guys can hear me. I'm going to go to my channel from my phone and go to the chat so I can hear. So I can see if you guys are commenting. Let me see. This is really ridiculous how okay, you say okay, so I'm seeing that you guys said the screen is frozen, but you can hear me. Okay. All right, guys, hang in there. Let me switch over to oh, thank you, Catnip. Catnip said the course is totally worth it. I highly recommend, worth every penny. Yes. So guys, my MA refresh course. Let me I'm gonna pin that in the comment section. And I'm trying to get into StreamYard, the software that I'm streaming from. I'm trying to get into it from my phone as well. I'm just waiting for them to send a code to my email. But thank you thank you guys for hanging in there and letting me know you can still hear me. Let me see, what's my code? And it's crazy because I can't even click on anything on my computer. I can't even scroll. I can't. Wow. This is crazy. All right, it's all good. I'm just going to have to switch over to my phone. That's all. All right, let me see. Okay, guys, sorry about that. I do not like being on StreamYard from my phone because it's hard to see the comments, but let's see. We're going to make it work. Congratulations, Craig. Okay, let me see. All right, thank you guys. Are y'all still in there? Can y'all see me now? Can you see me and hear me now? Oh goodness, I do not like being on StreamYard from my phone. Let me see how I can. Let me see if I can switch that. Let me see. My computer has become unfrozen now, so let me try to get back on from my computer. Okay, guys, am I back? Can y'all hear me and see me now? Affordable scrubs online, Amazon definitely. Let Daisy, guys, if anybody else knows where you can get affordable scrubs online, can you guys put it in the comment section? Daisy is wanting to know affordable scrubs online, but I would say Amazon. I actually have some in my my Amazon store. Okay, guys, I'm so sorry. Let me know, where did I leave off at? I was giving you guys some type of tip. I don't even remember where I left off at. I'm just looking at everybody that recently passed. Lala, congratulations. Craig, congratulations. Okay, I see some people that's about to. Okay, Elsa passed 425. Okay, congratulations. Catnip, congratulations. All right. CMA learn and study now and take my CMA for. Okay, got you. Okay. All right, perfect. Y'all can hear me. All right. I take my NHA CCMA Saturday. Do you have any tips? So yes, that's one of the things that I mentioned is make sure you download the test plan for the test you're taking. Make sure you are focusing on the content. You should be able to answer open-ended questions. And also anybody that's on here that's about to take the test, just go to my playlist on my channel that says study tips. And I have several different videos on study tips. I even address having test and anxiety as well. For those of you that do well in school, but then when it comes to testing, you don't do so well, definitely watch that video. Okay. And also for the person that asked about being a slow learner, watch that video as well, because that's going to be helpful to you as well. Let me scroll back up. There was another question. I can't remember what I was responding to when it cut off. I'm glad is that to praise you? I'm glad you caught me live too. I'm sorry you had to join with all these technical difficulties, because I'm sorry. That just, I don't know what happened with my computer freezing like that. Somebody said I'm starting medical assistant in the fall. Oh, that's Daisy. Okay, she's the one that's asking about scrubs. Okay. I'm glad you're here getting a head start. Somebody said I'll be taking my CCM exam for the third time sometime this month. I'll be watching your videos. Okay. So for everybody that's going to be taking the exam again, for those of you that just, hey, Shyla, for those of you that are taking it again after not passing before, just make sure you look at the breakdown of your score report so you know where you fell short. Do not take your test again without, oh, wait a minute. Did I get a hold on one second, guys. I think I got a delivery. Okay, so I did get a delivery. When I looked out there, I didn't see anything in my camera, but I just got an email that it delivered. So yeah, it was a delivery. Sorry about that. But you want to make sure you look at the detailed test plan. I'm sorry, the detailed score. So that way you know where you fell short. All of the areas where you fell short, you want to make sure you restudy those areas. Okay, let me see if Instagram's still hanging in there. Okay, Instagram, thank you guys. Y'all still hanging in there as well. But you want to make sure you restudy those areas where you fell short. Focus on those areas first. And when I say where you fell short, that means the areas where you scored the lowest in. Okay. Whether it's EKG, administrative. I'm gonna tell you guys the biggest areas that I've noticed people struggle in: EKG, phlebotomy, and administration. Oh, actually, and also dosage calculations. Those are the top areas that I get the most questions about. Every time I do a monthly study session, that's the biggest topics people want to cover. And so if that's you, definitely focus on those areas on the study guide. So if you guys get my MA refresher course, make sure you guys, wherever you fell short, go straight to that area first, because I do a lesson on it and then you have a quiz after. Okay. Do you have the study material for the NHS? Do you mean NHA, Michelle? Let me know if you mean NHA. I'm just asking because I know there's so many different organizations. I'm assuming you mean NHA, but NHS could be one as well. So let me know if that's what you mean, because there's so many different organizations that provide certification that it really could be one. Let's see who else. I saw something else. Okay, Shyla's working in neuroscience. That's awesome. That is awesome. Catnip says, just got my first job, but nervous about giving injections. Can you recommend a mannequin or something on Amazon to help doing injections? Nervous about doing babies and kids with no experience. Yeah. So I think I added some to my Amazon store, but honestly, all I did was I just searched on Amazon for injection kits and phlebotomy kits, and they do have them on Amazon. So this is for anybody, especially those of you who did not get any clinical experience, or you just want to practice at home. They have phlebotomy arms that you can order on Amazon. They have little like skin-like material that you can practice giving injections on. So yes, guys, go to Amazon. They may even have it on Temu as well. Temu is going to take a little longer, but you can try them. And also, no, that's it. Just Amazon and possibly Temu. Maybe even TikTok Shop. You never know, but Amazon definitely. I just know it's going to cost a little more on Amazon than what it would cost on Temu, because I remember seeing a kit for about $80 on Amazon, but they tend to be a little cheaper on Temu. Caitlin says, I'm late, but I'm here. Well, welcome, Caitlin. Oh, do me a favor, guys. Let me know where y'all at, where you are in your process. I know some of you guys have already told me. Some of you all are about to take your test. Some of you guys just got certified. A few of you said, I just started my MA program. Just let me know where you are. Are you already working? If you are, what specialty you're in, or if you're about to, start working, or if you're looking for a job, let me know where you are in my process and your process. And let me show y'all my video one more time. I'm so excited about this. Let me show y'all, for those of you that just joined, let me show y'all my video one more time. This is my I love it. My hair is not that long anymore. I cut it last year, but listen, I said she looked like me. She don't, but I say she do. All right. Let's see who else is on here. Okay, NHA. Yes, so it is for NHA. I see your comment, Michelle. Yes, NHA. Yes, EKG class was like beating my head against a brick wall. I passed, but I wanted to pull my hair out. I understand, Tim. I really do. EKG was my weak point when I was in school, so I get it. I'm gonna be honest with you, Tim. I think it wasn't until I started teaching that I really became good with EKG, because when you start teaching, for anybody that's interested in becoming an MA instructor one day, is when you're teaching, you have to know what you're talking about. So you have to learn, you have to really know this stuff. And it was literally preparing to teach when I first became an MA instructor that really helped me to get EKG. And now I just teach it in a simple way that I wish they would have taught it when I was in school. So make sure you check out well, you already done, but for anybody that struggle with EKG, make sure you guys check out my EKG video, because I am just making it super simple. Oh, thank you, Catnip. Taking my test Monday. Okay. Again, everybody that's about to test soon, good luck to you guys. Make sure you check out my study tips video. Looking for John. Oh, looking for jobs. Yes. For those of you, again, those of you that's looking for jobs, recruiting agencies. I'm telling you guys, MA recruiting agencies, going around the private offices. That's going to be your best bet. Okay. Catnip said, looks like you. Thank you. So Frazier said, I love it. Thank y'all. The Bradley family says, I love it. Thank y'all. Okay, guys. Let me see. I don't see any other questions coming up here. Let me go back on Instagram. Congratulations, cutest model on Instagram says, hey girl, you saved my life. I passed with a 418. Congratulations. Yes, I'm on YouTube. I'm on YouTube too. Beautifully Brina. Beautifully Brina on Instagram says my test is in May. Am I still frozen for you guys on Instagram? Let me know, because to me it looks like I'm frozen. Carmino says I take my test next Thursday on Instagram. Let me know, Instagram, if I'm frozen for you guys over there, because it looks like it's still frozen for me. I have a few other questions I'm going to address. I wanted to address the questions in the comments first, but I had some questions in my notes that I got from you guys in the comments. Is self-studying a good idea for medical billing and coding? Tawana, when you say self-studying, are you saying like not going to school for it and just learning it on your own? If that's the case, I would say I don't think it's a good idea, because there's so much that goes into medical billing and coding. Because when it comes to billing and coding, billing is one thing and then coding is another thing. So you're learning two different things. So I don't think it's a good idea. If you just mean studying, you did your program and you mean just studying on your own, that's fine. But if you mean self-studying where, you don't go to school, you just learn it and you get certified, I don't recommend that. Not for billing and coding. Something like medical administration is something you can self-study and learn on your own, but billing and coding is complex, because it's it's complex because you have, again, the code, and you have the beginner billing and coding, and then you have advanced. So you do the beginners first and you learn more advanced. And it's a lot. I mean, you can try. I know you say schooling is very expensive. You can try, if that's the only option you have right now, and to get as much knowledge as you can between YouTube and, any other free, like Quizlet and things like that. But I don't recommend it. Not for billing and coding, though. Michelle said, I wish I had you as a teacher. I went to currents and they did not prepare us at all. Unfortunately, Michelle, thank you for that. But unfortunately, I do hear that a lot, especially for people that are online and pretty much doing everything self-paced on their own. I do hear that a lot. And that's one of the reasons why I created my MA refresher course as well, for people like that, because, I just did the course and I'm teaching you guys the way I teach my students. So I'm sorry to hear that for you guys that did not get what you should have gotten in school. I'm sorry to hear that. But all you can do is work with what you got. So those of you that already went to school, you already paid your money, you feel like you didn't get enough. Only thing you can do is go forward and get as much as you can. When it comes to clinical skills, watch videos, as many videos as you can. So that way, when you go into the office and they're teaching you, you already have an idea. Hey, Ashley, you push your exam for this month on the 25th. Okay, make sure you keep me posted. Let me know how you do. It's funny because I thought about you too. I'm like, I don't see Ashley on here. All right, I'm going to answer a couple of questions that I had that I made a note from some of the comments that I got, but I wanted to make sure I answered from the comment section first. So somebody wanted to know if they need to be certified to become a medical assistant, and technically, you don't. Technically, when you finish school and you get your diploma, you are a medical assistant. Once you complete the curriculum, you are a medical assistant. Now, will you get hired without certification? Not always. Some people, they do get hired. There are some practices that will hire you and they will give you a certain amount of time to get certified. And then if you don't get certified within that amount of time, they won't, they'll let you know you got 3 months. If you don't get it, we're going to have to let you go. Right. So yeah, technically, you don't have to be certified to become a medical assistant, but it's going to be hard, especially these days. It was a little easier when I was younger and really coming up in this field, but now more and more places want you to be certified. Harris said, any tips for taking the test? I just talked about some tips, but Harris, make sure, and anybody else, make sure you go to my playlist, study tips. Make sure you go there because I just talked about a few study tips, but that's the number one question that I get. And because I get it so often, I'm saying the same thing. I usually just refer people to those videos because I say the same thing over and over. Another question I get, well, what would I be learning in the medical assistant program? And this is somebody that is thinking about becoming a medical assistant. And I think everybody on here, I'll say this for when I have a crowd that's not in school yet. So I'll save that one. Is the job of a medical assistant stressful? Yes, it can be. I'm going to be honest with you guys. It can be stressful because guess what? You're going to have some days where you got 2 or 3 patients that you got to give injections to. And then you got another patient in the lobby that needs to be brought back. The patient in room 5 needs an EKG. So yes, it can be stressful. And this is when it comes down to loving what you do. For me, I've been in this field since 2004, and I happen to just love what I do. I love people. So even when it gets stressful, I'm ready to leave for the day, but I know I'm coming back the next day. So that's when it comes down to loving what you do and knowing that stress sometimes comes with the job. Now, some offices is not as stressful as others. Some offices is more stressful than others, right? But to answer the question, yes, it can be. It doesn't have to be, and it's not every day. It's not always, but yes, it can be stressful. Is there a such thing as overstudying? Yeah, getting into the weeds. I've never heard that term used before, getting into the weeds, Tim. But yes, there's a such thing as overstudying. That's a good question. So, you're overstudying when, first of all, you'll know because you'll feel it. You'll feel, too overwhelmed, like you're doing too much. But it's like you already know the information. When you have somebody quizzing you and you know the information and you constantly keep looking at it and going over it and stressing about it, that's a sign that you could be overstudying. Another sign of overstudying is looking over things that you already know. So for an example, if you know your strong area is EKG, why you keep going to that part of the study guide, right? If you know your strong area is phlebotomy, you don't need to keep going there. Go to the areas that you find yourself avoiding. And that's a study tip for you guys. If you have an area that you feel like you always avoid because it's so hard, that's going to be the area that you want to really need to focus on when it comes to studying, because you've been avoiding it. That's probably going to be the area where you fall short in when you take your test. But yeah, you can definitely overstudy. Focus on what you need to get better at. And that's one of the reasons why I tell you guys to download the study plan. When you download the test plan for the test you're taking, you simply go to Google, download CCMA test plan, RMA test plan, and then you check off everything you already know. This is a way to avoid overstudying because you already know this. Now let me focus on the things I don't know. Overstudying, you're not getting any rest, right? You're not eating, you stressed out. This is why you got to set that time. Set a timer. If you want to study from 6 to 8 o'clock, that timer go off, you're done. You don't need to add in no extra time. 6 to 8, whatever your time is, set that time and then be done with it. I'm watching your videos right now and I test in 5 hours. Oh wow, Isis says she's testing in 5 hours, or is that he or she? I'm sorry, I can't tell by the profile picture. I just see the name. But good luck to you, Isis. Robin says math is the worst for me. Listen, Robin, I'm not a math person. I saw a meme the other day on Facebook. It said, don't ever talk about math to me. I've moved on. And I get it. Listen, Robin, I hate math. Okay. So I get it. I always struggle with math, but I'll tell you, because I struggle with math, I teach it in a way that's very simple. So make sure, if you haven't already, make sure you check out my dosage calculations video. If you just go to the search bar and do Miss K dosage calculations, it'll come up. But I promise you, I teach in the most simplest way because I struggle with math myself. So I'm just teaching it in a way that is easy to grasp because I struggle with it. So math and EKG, y'all, were my weak areas when I was in school. And so that's why I teach it the way I teach it. So I get it. Everybody else that struggle with math, I get it. So even if we don't pass the NHA, we're still medical assistants. Yes. So if you don't pass once you get that diploma, you are a medical assistant. Yes. Now I'm going to tell you guys I'm going to tell you guys when you're not a medical assistant, even when you finished all your classes, if you go to a school that requires you to do an externship to be complete with the program, you're not a medical assistant once you finish class. You have to do your externship first, okay? So some classes, with some schools, some programs, all you have to do is finish the program, the classes, and you're done. You get your diploma, you're a medical assistant. With some programs, they require that you have an externship before you get that certificate of completion, okay? So you got to know your program. This is why I tell people in the research phase, when you're trying to find a program before you even go to school, make sure you know, will I be a medical assistant when I finish, or do I need an externship, right? Just make sure you know your school, okay? But yes, once you finish the program, externship, whatever's required, you are a medical assistant. And then, of course, you get credentialed and you become a certified medical assistant. Do you have any advice on job hunting for someone? Yes, I just talked about that. No in-person experience. The number one way is going to be looking for a recruiter. So medical assistant recruiting agencies in your area. And then, of course, going around to some private offices. Oh, Isis, okay. I'm sorry about that. I can't really see. The picture is so small on my screen for some reason I can't see. So I'm sorry. I thought so because of the name, but I just didn't want to. I didn't want to be wrong. Thank you. I graduated 3 years ago, and I'm just not about to be certified. Oh, okay, got you. For people that went to school, make sure you check out my MA refresher course. Okay, it's especially for people like you. And let me actually put that on my screen. I'm just going to put it on my screen here. All right, let me see what else we got here. Must have been tough to conquer your mind. Oh, listen, Tawana, listen. Yes. When I was in school, I ended up getting a degree in psychology, but I did it online. And when I was going through my math class, Tawana, I had to have my cousin come over to help me with a lot of it because it was just so difficult. And that's one of the reasons why I teach it the way I do, because I keep it as simple as possible. The great thing is medical assistants, we don't need to know a lot. We just need basic dosage calculations. What the doctor wanted divided by what we have on hand, right? And then if it's a liquid, we got to multiply by the quantity, which is the 5 ml. But just check out the video because that's probably going to sound confusing. But yeah, it was tough. Like 160 or 180 hours. So yeah, so it depends. Some externships are 160, some are 100, some are, 200. It depends on the program. If you're taking the RMA, the registered medical assistant exam through AMT, they require that you have an externship of at least, is it 160 or 180? I can't even remember. I think it's 160. So in that case, you have to complete externship to even get certified with them. Yeah, they do require an externship. I can't remember if it's 160 or 180 for the RMA. That is the certification that does require an externship. Boss says we don't have an externship. Okay, yeah, some schools don't. I need help with prefixes, root words, and medical terminology. Okay, boss, I have a video. Actually, I think I have a couple of videos on that. So again, just go to my channel, or if you go to the search bar and just type in Miss K medical terminology. But I have a beginner's video on that that'll help with people that struggle with it. I also go into detail in my MA refresher course as well, for those of you that need it. I'll put that in here again. Let me put that in the chat again. For anybody that needs a refresher, you need help with anything, I just put that in the chat again. Young's rule? What's that, boss? Young's rule? Let me know what that means. Young's rule. Let me know. Let me go over to Instagram. I'm sorry, Instagram. It's hard to go back and forth on Instagram. Let me see. Let me go back up. Crystal, congratulations. Oh, Toro, I'm sorry. I'm just seeing your questions. Let me know if you're still on here, Toro. Comment. Let me know if you're still on here. I'm just seeing your comment. Let me know. Toro wanted to know what type of position should a CMA apply for to move up in their career. So listen, guys, if you're a medical assistant, you can move up to, you can become you could become an office manager. You could become a team lead, right? Of course, you can use medical assistant to work your way up into nursing, or what else? Radiology technician. Like, it's so many things you could work your way up. Okay, 12 are still here. Okay, I'm sorry, I'm just saying your comment. But yeah, so office man, I mean, it's so many, it's limitless, because you can, office manager, team lead, preceptor, of course, lab supervisor. There's so many different things you can do. It just depends on where you go that allow, that will determine where you're able to move into, because some places they only want nurses in certain positions, especially if it's a big company. The big companies, they want you to have a degree, right? But yeah, it's so many different things. Somebody said, what do you think of Smarter MA? I just bought a subscription. So I'm gonna be honest with you guys. I'm biased because I have a study guide, an online study guide. I think Smarter MA is a great resource. Before I created my own, I definitely was recommending people to Smarter MA. So I think it's a great resource. A lot of people, say that they've gotten it, but because I created my MA refresher course and it's a little cheaper than Smarter MA, and I'm actually teaching in it, I'm going to say I would prefer mine. So, and I'm just being honest, because I took the time, I used the testing plans to create it. I'm teaching on there the same way I teach my students, and then you get a quiz afterwards. So I would say the MArefreshercourse.com over Smarter MA. Let's see. Congratulations, Amor. Congratulations, Coco. Oh, a lot of y'all passed. Congratulations. Okay, Cocolina said I use your refresher course. See, I'm telling y'all, people been getting my course and they've been passing. Like, I'm going over every single thing. The testing plan that I told you guys you need to download, I use those to create the course. I need help to study. For anybody that needs help studying, I'm doing a another group session. I'll just put it in the chat on one day next month. So on certain Saturdays of every month, I do group sessions where you sign up, you have me for up to 2 hours or more, depending on how long we go, to get help. Like, you get tutoring. It's a group session. You got to have your cameras on. Everybody that's on, they got to have your cameras on, but it's a virtual group study session. So I'll put that in the chat too. Bookwithmissk.com. So it's YP. If you need like that type of session, you go to bookwithmissk.com. You'll see the virtual group study option, and I'll put it here on Facebook and Instagram too. But bookwithmissk.com, you'll see one-on-one options, and then you'll see the group study session as well. Let's see. My plan is to eventually get into sports. Oh, I love that. Sports medicine, and maybe join a collegiate sports program. Oh, I love that idea, Tim. I love it. And shout out to you, Tim. I love to see males on the channel because, the medical field, nursing, medical assistant, it's you see more females in this career, in this field. So when I get male students, I love it because a lot of you guys are in demand because they don't have a lot of male medical assistants, a lot of male nurses. So when I was at my former school, we would actually get calls and requests like, do you guys have any male medical assistants? We need males. So I'm happy to see you here. In my medical assistant group on Facebook, it's called the Medical Assistant Lounge. There was one guy, he posted, he was like, hey, is it any other men in here? If it is, comment here. Like, he's like, where the rest of the men at? Because it's just not a lot of you guys in the field. So, shout out to you and anybody else that's watching. Any other the male medical assistants that's watching, shout out to you guys. I love it. Okay, Toro says, you're welcome. You're welcome. All right, guys, let me know. We have 42 minutes now. So let me know. I'm gonna start winding down. Let me know if you guys have any other questions. Michelle says, when is the next class? When did I set the next class for? I set it for next month. I don't even remember which date I set it for. Let me see. This is April. What day did I set it for? When you go to bookwithmissk.com, you'll see. As a matter of fact, let me go to bookwithmissk.com so I can see. I don't even remember which day I set it for. The last one we did was a couple of Saturdays ago, March 30th, and I think I set one for April as well, or did I set it for May? Oh, April 26th. Okay, so the next one is April 26th, guys. The next group session is April 26th. So when you go to bookwithmissk.com, you'll see virtual group study and tutoring session, and it's going to be April 26th. And I'll eventually put a date on there for May. I don't know when yet, but I'm going to try to do it at least once a month, if not every other month, because people keep asking about it, keep asking for it. And so I said I can definitely do that at least once a month. Congratulations, Kaylee. Queen Alicia says, I miss every live and I finally made it. Oh, Elle from YouTube. Hey, Elle. I'm glad you made it. Listen, I have not gone live. I have not posted not one video on YouTube since sometime in February. I did not post anything for the month of March. I think that's, for the entire month. So you haven't missed anything. Instagram, do me a favor. Let me know. Am I still frozen? Let me know if I'm frozen. If I'm frozen, I definitely thank you guys for hanging in there from watching a frozen screen. All right, guys. Oh, let me see. Was there any other questions in this in my notes that I wanted to get to your questions in the comment section first, but I have a lot of you guys asked a lot of questions, and what I try to do, I try to just screenshot them and make notes in my phone to address them but you guys asked a lot of questions. So it's some more, so many questions. Let me see what's the one I can the difference between a medical assistant and a nurse. So you guys know that nurses, first of all, are licensed. Medical assistants, we are assistants to the provider, right? Nurses are licensed in the state that they work in, right? As medical assistants, our certification is national, meaning if you live in um, Boston, you can work in DC or Maryland or wherever because it's a national certification. Whereas when you're licensed, you have to work with your license. And of course, the nursing scope is much broader than an MA. So there's a lot of things that nurses can do that MAs cannot do. Nurses can assess, they can advise, right? Certain and certain with certain licenses, they can even diagnose, right? So the scope is much broader as a nurse. Of course, schooling is longer. You're actually getting a degree in nursing. Yes, there are medical assistant degrees as well, but with nursing, you definitely have to get a degree. You have to, when you finish school, they have to do clinicals that are mandatory. It's not like medical assistant where, depending on your program, you may or may not have an externship. It doesn't work like that with nursing. You go to school, you apply to the nursing program. Even when you finish that, you have to do your clinicals, and also you have to take, you have to get licensed. You have to take an exam to get licensed. So it's a lot more, it's a lot more detailed, broader scope. Of course, we can assist nurses. And one thing too, guys, don't ever call yourself a nurse if you're not a nurse. So if you're a medical assistant, I know sometimes patients will refer to you as a nurse. If they say it in passing, like, I had a patient on the phone, let me call you back, I'm in a room with my nurse. I'm not going to necessarily, correct them. Hey, I'm not a nurse. No need for that. So some patients are going to do that. However, you should correct them if they ask you, of course, or if they're referring to you as a nurse, and you can correct them, or you never want to introduce yourself as a nurse. You are a medical assistant. We're not licensed, so you definitely want to make sure you are communicating that. I remember coming up in the field, I thought that that's what they do. Like, honestly, they're like, okay, we're nurses, like we're like nurses, but really, no, we're not. That's just like if someone, as a medical assistant, you went to school and you did a lot to become a medical assistant. You don't want just anybody just saying, oh, I'm a medical assistant, and they're not. Especially you did that work to become that. So I'm an MA working in phlebotomy, and I want to be certified in both. Can you tell me anything really quick? Yeah, just go to NHA. Are you already signed up with NHA.com, Robin? Just go to NHAnow.com, Robin. And that's for anybody. Anybody want to get certified in MA and phlebotomy? I know you mentioned you've been out of school for a few years. Go to NHAnow.com. And guys, actually another announcement, I'm going to be starting to do phlebotomy certification practice as well. So you guys know I only do MA certification and medical administration and medical system, and I'm going to start doing phlebotomy soon as well. I have a book that I'm working on right now that I'm trying to get done before Father's Day. So it's not going to be anytime soon. I want to get this book done within the next, well, if I have time, I will, but I don't think I will within the next couple of months. But I'm working on a book that I want to have done by Father's Day. So you guys know, in addition to being in the medical field, I'm also an author. I've written 4 books, but I have a new book that I'm working on. It's a daddy-daughter book. It's just about the importance of a dad in his daughter's life. Okay, so I'm just talking about things daughters need from their father, and I want to be finished by Father's Day. So I'm not going to be doing anything big on this side of things because I want to get that book done. Yvonne says, hello, Miss K. I tell everyone, I got to put this on the screen. Hold on one second. I have some people coming in here to do some work in the house. 1 second, but let me put Yvonne's comment up here so you guys can see it. I'll be right back. Hold on 1 second. Okay, that was actually another package. I thought that was the people coming in here. They have to do something to my kitchen sink. But anyway, Yvonne says, hello, Miss K. About your videos. I think I'm doing it to help more than you know. God bless you. Oh, God bless you too. Congratulations on passing NHA 2 years ago. Hop on. You are so welcome. You are so welcome. I can't see the rest of her comment here, so I'm looking on the side. Yes. Wow. Thank you so much for sharing that, Yvonne. Thank you. This is exactly why I keep the channel going. Thank you so much, Yvonne. Thank you. And congratulations. I can't see the rest of your comment, Yvonne. Do me a favor and send me a DM, Yvonne, because for some reason it won't let me see your whole comment. So just send me a message on Facebook. David, oh, we got another mail here. Congratulations, David. 481. That is excellent. David got a 481. That is excellent, because you guys know the perfect score is 500. That is excellent. Alexandria, Virginia. Oh, that's awesome. Oh, okay, congratulations. Okay, you're near me, David. Congratulations. Are you doing mentoring also? Okay, so listen. I started a membership, guys. It's $9.99 a month. I have not promoted it, but I started it because I've been helping people start businesses and stuff like that. But I'll be honest with you guys, don't join it now, because I haven't really mapped out the days we're going to meet up and all of that stuff. But yes, technically I do mentoring. I started a membership. It's $9.99 a month. But I have not really mapped out the days that we're going to meet and all of that. I'll put the link in the comments for anybody that want to join it. Yes, I do mentoring, but it's group. It's in a group. So if you want to do like a one-on-one, that option is at bookformissk.com. But if you want something cheap, that's only $9.99 a month, and we can constantly meet at least once a month, once or twice a month, then yeah, you can join my membership. But I'm going to be putting that out there when I have the date set. Like, okay, these are the days we're going to meet. And this, this is what we're going to do. These are the topics. But yes, I do have a mentorship. It's $9.99 a month. Okay. And I'm going to not just be the only one teaching. I'll have other people coming in as well. About medical assistant interview questions. Yes. So I do have some interview questions on there, Quizm. So if you go to my playlist, or actually go to my live videos, because I did some live videos on that very thing. So if anybody else needed the medical assistant interview questions, yeah, that's under the live videos. Yeah, make sure you inbox me, Yvonne, because I couldn't see the rest of your message. I watch your videos about this topic, but it's just short clips. Oh, no, I have a live Quizm. If you look on my channel, there's a live video on preparing for an interview. And then people that were watching live, they also were given some examples as well. It was like maybe it was like a couple months ago. So look like a couple months ago, and it was under the live section. But it was a whole video just about preparing for an interview. But of course I can do another one, because it's not like I don't do videos all over again, because it's always something more to add. So I can definitely do another one and add more to what I had. Let me go back over to Instagram. I'm sorry, y'all. I passed my phlebotomy exam in December. I just completed. Congratulations, Elle. I need more help with taking blood pressure. Do you have any info for that? Toro, are you following me on YouTube? If not, make sure you go to YouTube and look up my blood pressure video. It's medical assisting with Miss K. Same name, same Instagram, same name as my Instagram, medical assisting with Miss K. And when you click on my videos, click on popular, because I have the most views on that video. So when you go to my channel, click on videos, click popular, and the blood pressure video will be the first one to come up, because it has the most views on it. And the way you become fast with readings, I love that, Toro. So Toro said, Toro says, I know how to take it, but I need to be fast with readings. So guys, your goal for taking blood pressure, I love that you said you want to be fast with the readings, because you should be fast with the readings. When you guys are taking manual blood pressure, you should be able to just look at it and know the numbers. You shouldn't have to go 2, 4, 6, 8. You start off like that, but you should know when you're looking at the lines, the smaller lines, right? Remember on the blood pressure cuff, the sphygmomanometer on the dial, you had on the diaphragm. Oh shoot, y'all got me saying the wrong thing. On the actual sphygmomanometer, right? On the actual meter, you can, not the diagram, I'm sorry guys, the diagram is the part that goes on your arm, on the artery. But when you're reading the actual meter, right, you know, the bold lines are red and tens, the smaller lines are red and twos. You should automatically be able to look at each line. That second line is 2. I'm sorry, the first line is 2. The second line is 4. The third line is 6. The fourth line is 8. So you should automatically be able to look at it and know it. That's the goal. So I love that you say you want to get faster with it, because nobody should be in the doctor's office checking blood pressure and going, okay, 2, 4, 6, 8. Just look at it. You're going to look at it and know what it is, because you know that first line is 2, second line is 4, third line is 6, and the fourth line is 8, right? But for those of you that struggle with blood pressure, you need a little bit more help, just search the search bar on YouTube and just go blood pressure Miss K, and the video will come up. Or click on my channel, videos, and popular, and you will see that video, because it's the #1 video on my channel. Kimmy says, hi, I drew blood for the first time today. Congratulations, Kimmy. That's awesome. Silver says, please keep me informed about the mentorship. I would definitely join. I think I do follow you, but we double check. Thanks again. Yeah, so just look up medical assistant with Miss K. And yeah, guys, the membership, it's I started it, but I don't really promote it like that, because I didn't really want you guys to sign up yet. And I know I haven't said it, but what I'm going to do is I'm going to, especially since I'm going to be switching over to working full time as of Monday, I need to set those days out. So just look out for that announcement. So make sure you guys have your notifications turned on, because I'll be announcing it soon. Alexis, I love you too. Thank you. Thank you. When you renew, you have to keep taking NHA. Absolutely not. This is one of the common questions we get too. When you guys take your certifications, you never have to take the test again unless it expires, and then you miss the grace period. So let's just say your exam expires today. They give you a grace period. Some of them will give you even up to a year. If you don't renew it within that time of your grace period, then yes, it's going to lapse and you have to take the test again. But other than that, no. Once you take the test, all you do is you keep renewing it every 2 years. If you are CCMA certified, if you took the RMA, is every 3 years. The CMA, AAMA is every 5 years. And in the middle of that, you have to do your CEUs, your continuing education units. Okay. If anybody has any questions about CEUs, I already talked about it on the video. So that's another thing. You can look up CEUs Miss K on YouTube, and the video should come up. All right, y'all. I'm going to get ready to end this. I'm getting a little tired of talking. Talking is exhausting, guys. I don't know if y'all know. Talking can really make you tired. That's one thing I'm not going to miss about teaching, is talking. So for those of you that just joined in later, I did make the announcement. You guys know I'm a medical assistant instructor. However, as of Monday, I will be full-time back in the cardiology office. I'll still be doing videos and stuff. I'll go back to teaching too. Over the years, I've gone back. So I started off as a medical assistant, taught for a couple of years, went to the cardiology practice I'm going back to now. I was there for 4 years, went back to teaching, been doing that for the last 8 years. And then now I'm about to go back into the field. So I'll be at the office. I used to work there full time. Now I'll be there. I'll be doing some patient care, but I'll be more so assisting like the managers. I'll be helping with scheduling and things like that, the schedules and stuff. So it'll be a little different than I'll be more in a supportive role, right? Helping out, doing some precepting and things like that. So, all right, guys, I'm going to let you go. I appreciate you too, Tora. I appreciate you hanging in there. I really do. God bless you too. Yep, Tora says just took my CEU and passed. Yes, keep up with them CEUs, y'all. All right, guys, let's see. I just want to make sure I didn't miss anything on Instagram. Follow me on Instagram, Miss K. Okay, I got you, Tora. I'll follow you. Matter of fact, let me see. Can I click on it while no, I can't click on it while I'm live. But yeah, I'll follow you, Toro. Do me a favor, Toro. Like one of my videos or something, because I don't know if I'm gonna be able to find you once it's live in. So just like something so that way I can see your page and I can just follow you. Videos. Sweetest my 24 says I wanted to say I watched the videos and they helped me and took my CCMA and I passed. Congratulations. Congratulations. So guys, you'll see a couple of videos posted. I did record a couple of videos today. And you'll see them posted. One of them I talked about studying tips. Another one I talked about externship tips for pediatrics. That was a question in the comments as well. Ms. K, I'm going to be honest with you. I'm looking to get as many credentials as possible. Next time we talk, maybe you can suggest, listen, okay, yes, get all of the credentials. Listen, all of them, your medical assistant certification, phlebotomy, EKG, everything you can get. Yes, get them all. Get them all. Why not? Focus on one at a time. Get one. Get your medical assistant certification first. Then do your phlebotomy. Then EKG. And then anything else you can get. Surgical tech. Whatever you can get. Get them all. Yes. I'm getting ready to go to Jennifer. Thank you for hanging in there with me. I'm getting ready to go to. Jennifer said, listen, I got to go. This has been long enough. I feel the same way, Jennifer. Now you upload more videos on YouTube. Yes, that's a plan. I've set Wednesday as my day to record videos. So that's going to be the goal, to record multiple videos on Wednesdays or go live. And then the videos that I record, I'll release them maybe on Mondays, or I'll decide on the day I'll be releasing them. All right, guys, let me go back to Instagram real quick. Let me see. All right, guys, you have a good day too, Toro. All right, y'all have a good day. Thank y'all for hanging in there. Love y'all. Oh, let me put my let me end with my video.